Beut Type III, Lateral Cheek Projection and Volumization. The injector begins by positioning themselves behind the patient to get a bird's eye view. Pre-procedural observation and analysis must determine if the patient needs cheek volumization or increased projection of the lateral cheek. The technique for increased projection is performed through the lateral cheek insertion port, positioned 2 cm inferior lateral to the lateral canthus and in line with the supratarsal fold. The cannula is advanced in a steep, downward fashion while performing a pinch and pull technique of the orbicularis and superficial compartments. Resistance will be felt at the prezygomatic capsule. The injector will proceed through the capsule, passing the cannula over granular periosteum, where the texture of the bone will be felt by the injector. Once in position, a bolus is placed at the desired area of maximum cheek projection. The injector will watch for a topographic tenting effect on the skin until appropriate malar projection is achieved. Effective effacement of the V deformity requires volumization targeted between the mid-pupillary line and lateral orbital rim. This technique is performed through the nasolabial insertion port. A pinch and pull of the cheek in line with the lateral canthus will ensure passage within the prezygomatic space medially. A lateral vector in a superficial plane can be used for a calculated fill cephalic and lateral to the zygomatico-cutaneous ligaments. Here we demonstrate conceptually the differences between projection and volumization. In this patient, we demonstrate the approach for type 3 projection. The cannula is inserted through the lateral malar insertion port. Once in the correct position, a pinch and pull combined with a deep vector will push the cannula through the prezygomatic capsule. That popping sound confirms passage into the prezygomatic space. From a bird's eye view, we can see the excursion of malar tissue giving the tent effect for cheek projection. In this patient, we demonstrate type 3 volumization. A pinch and pull of the cheek in line with the lateral canthus ensures proper position. A superficial fill is placed cephalic and lateral to the zygomatico-cutaneous ligaments. Medially, the inferior limits of the prezygomatic space are volumized. The end result is a greater radius of the cheek. We propose occluding the area with an occlusive dressing for 24 hours to reduce edema.